So we've talked about the American healthcare system by the numbers, but it's important to understand how it is we got here. So we're going to take a little patient history, if you will, of the American healthcare system. So how did we get here? It's important to remember that medicine, as we know it, it's not how it always was. Doctors certainly weren't trained in the same way in the past, and they were often seen as quacks. When we think about the American healthcare system, one of the places we can look for a transition is the Civil War. 5% of the US population died in the Civil War. 620,000 dead is the deadliest war for the US ever. But of those dead, two-thirds died of disease and not from battle wounds. So part of this was that you had unsanitary surgeries and no understanding of germ theory. And this cost lives of many soldiers who, in today's medical system, would have survived. The medicine of the Civil War actually serves as an impetus to improve medical care. But there's another legacy as well. After the Civil War, an informal system of providing health insurance or death benefits emerges. The Republican Party, the party of Lincoln, gave to all Civil War veterans from the Union health care. And what happens is that the Democratic bosses in urban centers gave to the people in those areas, their constituencies, those benefits as well. So as a result, you don't have the outcry for national health care here the way you did in other countries, because over time, what each of these parties did was they expanded the benefits to the descendants of those soldiers or to larger and larger areas around democratic centers. So there's this power of the American rugged individualism that makes Americans disavow the need for national health care, despite the fact that in many ways it's actually already being provided. When the Great Depression hits, FDR changes many things in the United States, introducing a variety of social programs and safety nets. And FDR wanted to move to universal health care as part of the New Deal, but even at the time, it was too much of a fight. Many saw the attempt at having universal health care as an institution of socialism. I don't know if this sounds familiar to anyone. And one of the groups that fought against health coverage was the AMA. That's right, the American Medical Association. During the Depression, many Americans couldn't afford basic medical care and were thus going to the doctors less. And so doctors saw their revenue decrease, just like everyone else during the Depression. And so in seeking a remedy for this, the AMA decided that what they needed to do was not expand access through expanding insurance coverage, but actually by recommending the closure of half of the country's medical schools so that you could divide the revenues among a smaller pool of doctors. Roosevelt tried several times to bring the issue of healthcare, of universal healthcare, before Congress, but each time it faced strong opposition and it died in committee. Now, World War II has a major influence on healthcare policy. There was a salary freeze by the government as part of wartime restrictions. And what happens then is that businesses found a way to attract new workers by offering health benefits. These benefits weren't considered raises, and in 1943, the government decided to exclude the value of healthcare benefits provided by employers from taxable income. And this is really that beginning of where we see private health insurance paid for through people and their businesses as really starting. So the money to insurance became tax exempt and remains so to this day. There's another consequence of this, which is that people don't think of the cost of their health care as part of their compensation, but it's an additional maybe 15 to 20% that an employer is paying per employee. Now, this decision was to have lasting influence on the healthcare system in this country. The creation of the tax-exempt status for healthcare benefits formally made private health insurers part of the healthcare delivery system here. And it makes them major players in the healthcare system and debates. No major healthcare reform attempt in this country can work without addressing private insurers. At the time that the practice emerged, healthcare costs were really a small part of the cost of employing workers. Employers bargained with insurance companies for better rates, and because of the tax exemption. And so as a result, most insurance was procured through businesses and not the individual. When FDR died suddenly of a brain hemorrhage, Truman took over the fight for universal coverage. Where Roosevelt had been cautious, Truman was bold. In 1945, Truman asked Congress to establish a national health insurance plan. For this, he was called a socialist, and he failed. So from there, we have a pause, and it takes 20 years for Congress to act after that. And when they do, it is the Great Society. This is 1965. Congress creates the program of Medicare and then also Medicare and Medicaid. And it's passed by Lyndon Johnson as part of the Great Society program. Once again, the American Medical Association tried to block, even joining with the tobacco industry, arguing against the just released Surgeon General's report on the dangers of smoking in order to block the Medicare bill. Medicare passes in 65 to cover the health insurance costs of all Americans 65 and older, as well as those with disabilities. And the first recipient of a Medicare card was Harry Truman. So what were some of those barriers to passing Medicare and Medicaid? Well, first, fear of socialized medicine. As was the case in the 30s and 40s, many people objected to government health care because of a fear of socialism. They didn't want the government to interfere or oversee their practices. That was from the doctors. And they didn't want the government to pay them. So in order to address those concerns, Medicare and Medicaid were set up as government insurance. So at least initially, there was no one being paid directly by the government. It was all sort of fee for service. Private practitioners could then choose not to see Medicare and Medicaid patients. And we see the result of this now, where there are really a shortage of doctors willing to take Medicare and Medicaid. Finding doctors who do can be a real challenge. Now, in order to understand this is the American context, we have to deal with the fact that racism is a huge component. Because white doctors did not want to have to treat Black patients. In the 1960s, healthcare was one of the most segregated areas of American life, and it remains fairly segregated now. The Johnson administration, their accommodation has vast implications for the future delivery of medical care. Medicare and Medicaid did have the effect, though, of officially desegregating hospitals because Title VI of the Civil Rights Act that passed in 1964 prohibited discrimination on the basis of race, color, and national origin in programs and activities that received federal financial assistance. So thus, any hospital that accepted Medicare and Medicaid were required to treat Blacks and whites. No hospital could afford not to accept Medicare, and as a result, you have the desegregation of hospitals. So let's look at Medicare and Medicaid, because they're different programs, though both from the federal government. So Medicare, Before Medicare, only 51% of people aged 65 and older had health care coverage, and nearly 30% lived below the federal poverty level. Medicare was seen as a way of protecting older Americans who'd worked hard. It was a safety net for the deserving, the working. So as we look at this, as a program type, it's social insurance program. It's for everyone. Once you turn 65, and although we're raising that some, and some people who are disabled, you're eligible. And in terms of coverage, there are multiple parts: hospital insurance, medical insurance, and prescription drug coverage. The funding comes from federal payroll taxes, general tax revenue, and beneficiary premiums. We've had a conversation about Medicare for all in this country, where there's an idea somehow that Medicare for all means no private pay from individuals. That's not true. The majority of senior citizens receiving Medicare also have to pay dues in addition. It is part of the system, and there's been an oversimplification of this debate that I think is really actually problematic for coming up with solutions. Now, Medicaid is a completely different program. It was also passed in the Social Security Act of 1965, but it was a subsection devised to treat the poor. So the program type, this is a social welfare protection program. And eligibility is for low-income families with children, the elderly, the mentally and physically disabled. So if Medicare is for the deserving, really Medicaid was for the undeserving, as formulated at the time. The coverage, you have hospital stays, medical care, nursing homes, home health aides, and various additional benefits by the state. And states actually, there's a huge difference in benefits depending on what state you're in, because it has shared funding. Unlike Medicare, which is at the federal level, Medicaid is supported at the state level. It is the nation's public health insurance program for low-income Americans. And it finances health and long-term care services for more than 55 million people. The program provides access to affordable and comprehensive health care for children and adults. And your eligibility is determined by income. The main criterion for eligibility is your income level. And to be clear, that is not part of how Medicare is funded. The minute you turn 65, you become eligible for that. Poverty alone, incidentally, doesn't make you eligible for Medicaid. You can be poor and not qualify. It's also important to know that although 3/4 of Medicaid enrollees are adults or children, the elderly and the disabled account for 70% of the program's expenditures. So it also has a great deal more coverage than Medicare. So oftentimes you have people who are dual eligible, Medicare and Medicaid. So you're over 65, but you're below the poverty line. And thus you get services from both. Nursing home care is funded through Medicaid. It is operated jointly by the states and federal government, with states providing up to half of the funding for the program. In some states, counties also contribute. So this difference in funding sources, again, goes to a disparate system where we have better funding for Medicare than we do for Medicaid. And the reimbursements to doctors are also lower for Medicaid. And this means that there are, again, fewer doctors who are willing to accept Medicaid patients. Medicaid accounts for roughly 1/6 of the nation's healthcare spending, and almost half of all that spending is on long-term care. So when we're thinking about Medicaid, as we talk about Medicare for all, it's actually Medicaid that's doing the bulk of the heavy lifting. There are some other programs that are involved in expanding healthcare in this country. Briefly, there's EMTALA, which stands for the Emergency Medical Treatment and Labor Act, and that ensured public access to emergency services regardless of ability to pay. That means that doctors and hospitals, but particularly hospitals, have to treat everyone. But that's an unfunded mandate because people can't pay, and that is a problem for hospitals. Another expansion was HIPAA, the Health Insurance Portability and Accountability Act. And this had multiple elements to it. And you're probably used to signing things, a HIPAA declaration when you go to a physician, which is basically there to let you know that you have privacy rights and general standards of care. Next to know is CHIP. This is the Children's Health Insurance Program, and that was enacted in 1997, which provided a capped amount of federal matching funds to states to cover children and some parents with incomes that were too high to qualify for Medicaid, but for whom private health insurance was either unavailable or unaffordable. CHIP also covers pregnant women. It covers now roughly 9 million children and 370,000 pregnant women, and it's played an important role in reducing the number of uninsured children in America. Just so you know, this was spearheaded by Hillary Clinton and the late Senator Ted Kennedy. So this is a really important part of our network of health insurance sponsored by the government. And lastly, we have Obamacare, the ACA, the Affordable Care Act, which was passed in 2010. We're going to talk much more about this in the next video. But just briefly, it was based off of Mitt Romney's plan in Massachusetts, which itself was developed through a think tank, a conservative think tank, and it is a market-based solution for healthcare. The Heritage Foundation had put it forward as the alternative to Hillary Clinton's plan in the 1990s to reform health insurance. All right, we will talk more in the next video about the Affordable Care Act.